Peter, hi. We've been working together now for a few years in the Transforming Integrated Care in the Community project.
Yep.
So my first question is, what's the best thing you've experienced about trying to bring... I love the expression you've used is the Buurtzorg produced an acorn from their wonderful oak tree,
Yes.
and you've planted it in Kent.
Yes.
What's the best thing about that?
Yeah, no, it's a great metaphor for us anyway, because Kent's the Garden of England. So it's a good metaphor. It's been helpful with our staff to basically say, here's the acorn, here's the Buurtzorg principles, which we know from other research are a really great way to support people in the community, a great way to support patients. And we've used that metaphor and extended it. So we've basically encouraged our staff to think of themselves as gardeners, you know, nurturing their own little oak tree. So yeah, the best thing has been working with our frontline staff, really. Literally being moved to tears at times by the stories they're telling about the care they're providing. I mean, I'm talking about tears of joy as well as sad tears. So yeah, getting people back gardening again, getting people back shopping, getting people back within the communities that they're from after a period of ill health. So yeah, it's been a privilege to work with Buurtzorg. We've learnt so much from Buurtzorg and from Public World, and yeah, it's been wonderful to take those principles and try and develop something unique for Kent, but based on those principles.
Thanks. And that's 4 years this project's been going on. Two of those have been the COVID years.
Yes.
So what's been the biggest challenge you've faced in this?
Yeah, I think COVID is the biggest challenge, if I can be honest. So we've continued to work with teams, we've continued to engage with teams, and actually the Buurtzorg principles have been really helpful because they're quite naturally within the Buurtzorg principles. There's a focus on personal well-being. So I would express that as the team itself is a community, and if the team itself sees itself as a community of support, you know, mutual support, mutual aid between one another and collaboration, it helps them then reach out into the rest of the community. So to the GPs, to the OTs, to the speech and language therapists, to the other sort of formal partners they work with, but also voluntary sector partners. So yeah, it's been a big challenge, but it's helped people reflect a lot more on purpose, what's important for them, what's important for the patient. We've seen levels of trust increase because we've not been able to see people in offices. We've had to, well, I say had to, we've naturally let people have a lot more freedom. You know, Jos de Blok would say, nurses know how to nurse. That's how they're trained. They're trained to be problem solvers, and COVID has allowed the opportunity that we probably wouldn't have had without COVID. I mean, we wouldn't have chosen to have COVID, don't get me wrong, but it has been an opportunity in lots of ways.
Finally, if there's one thing you've learned through this project that you wish you'd known at the beginning of the project, what would it be?
Wow, that's a great question. So my background before I came into this project was in coaching. So I've always tried to listen before I speak. So we set up 2 pilot teams. What I think I would have done differently is I would have gone to and we set those up as new teams. What I think I would have done differently is I would have gone to an existing team and worked with them on the principles and to embed those principles in a team that was already used to the organisation and used to all of the processes of the organisation. Of course, we would have had to change a lot of them, as we have done with this project, but I think that would have meant we would have travelled faster earlier. So we set up 2 pilot teams of new staff. We recruited new staff into the organisation. We then rolled out to existing staff, but I think it would have been better to start with existing staff.
Peter, thank you very much.
Thanks, Brendan.